Hi there, it's Dr. Mary Barbera here, and I am live for another episode. And this time, today, I am going to talk all about medical issues and what that entails for kids with autism or starting to show signs of autism. So if you are here in the comments, let me know where you are viewing from. I am a little earlier today. This is day 25 of my 30 live sessions. So let me get my other friends here and we will get rocking and rolling. Okay, hi there. It's Mary Barbera here, and we are doing live day 25 out of 30 lives, all in anticipation of my new book coming out in just 5 days on March 30th, Tuesday. It will be out and about. It's now available for pre-order. TurnAutismAround.com will get you there. So we are talking today in the comments. Please let me know you're here. And also where you're viewing from. If this is your first time hearing me, let me know that. If you've already pre-ordered the book, that would be excellent to mention too. So I make sure everybody can hear and see me and we are good. And then we will get going with the topic today, which is all about medical issues, how to teach a child to tell you they're in pain, how to teach a child to take medications, how to teach a child how to get a COVID test or wear a mask. And while we don't have a specific medical chapter in this book, medical issues are covered in a few of the chapters. So if you haven't ordered, we have somebody from the Bahamas. I was there actually on my honeymoon. I was in the Bahamas. I think I may have been there a couple times. Cincinnati, Ohio. Is it only in English language when it comes out? Yes, for now. It does have translation rights through Hay House, and it will be coming out in Korean and Chinese so far. Those have been contracts, purchases of the translation rights. So, but I've been told that takes 18 months to 2 years. So I'm dressed up a little bit because I was just on a TV show that's going to air on Easter Sunday, April 4th at noon in Atlanta. So that was exciting. Okay, so I thought I would get my live done for today. Okay, so we have Grandma Carol from Kansas. Excellent. Beatrice from Illinois. We have somebody from Florida, Panhandle, and they've already pre-ordered. Dina, Rhode Island, waiting for your book. My husband pre-ordered already. Excellent. Juliet from the UK. Awesome. And as I'm talking, I might actually try to do this as a podcast because I was looking and there seems to be a lot of medical issues coming up for people. And so I was thinking maybe I would try to do like 20 minutes on the subject and try to publish this as a video podcast at some point soon. So let me try to make that happen. So it will be more like a lecture for 20 minutes. And then I'll come back, go on, answer your questions, preferably on the topic of medical issues or medication or pain or something like that. Yeah, because I think it's a really important topic. So let me see if I can wing this. I have like this many notes, like nothing. So we'll see if I can talk off the top of my head to make it make sense. So let's try to get this podcast done at the same time. Okay, so here we go. Take one. Hi there, I'm Dr. Mary Barbera, and welcome back to another episode of the Turn Autism Around podcast. Today we are talking all about medical issues in the autism world, how to get your child, the importance of ruling out medical issues, the importance of getting your child to describe when they're in pain, how do you go about starting that, how to get your child to go to the doctor and get an ear check, or and then also how to get a child to take medication if that is prescribed. Lots of issues here, so let's get to it. Okay, so today we are talking all about medical issues. And for those of you that don't know me, I am, in addition to being a mom of a son with autism, as well as a board certified behavior analyst, author, online course creator, I've also been a registered nurse since the mid 1980s. And I know I'm sounding very old as I say that. But I think because of my nursing background, that has really made me a better behavior analyst, a better mom, a better detective on our journey, specifically with Lucas, but also for many, many of my clients. While my new book, Turn Autism Around, doesn't have a whole chapter on medical issues and medication use and teaching your child to tell you they're in pain, I do mention medical issues a lot in this book, and I do believe it is part of the puzzle for sure. So today I just wanted to go over the 4-step Turn Autism Around approach and how we can begin to make progress in all of the medical problems that might come along the way with autism, or even signs of autism. And we're going to work through those 4 steps. And I'm going to tell you, hopefully, some tips to start turning things around medically. And a lot of times that's tied to also turning things around behaviorally. So I have done previous video blogs on all of these issues. Ruling out medical causes is, I think the blog says something like easier said than done, because it is quite complicated. I did a video blog about how to teach your child to tell you they're in pain. I'm going to summarize all these video blogs here. I have another video blog on teaching your child to take medication. I also have a couple podcasts that are more medical, namely one of my favorites that I mention all the time with Dr. Michael Murray, who's both a dad to a son with autism, as well as he's a psychiatrist, and he's Lucas's psychiatrist. He's podcast number 28. I also did podcasts, and we talked about medical issues with Dr. Melissa Olive, who's a board certified behavior analyst, and Denise Voigt, who is a nutritionist and a functional medicine nutritionist. So you can check out those video blogs and podcasts. Those will be in the show notes. But let me just summarize, because I think, we have limited time to be going out and watching all these video blogs and trying to put it together. Plus, it's been a couple of years since some of these video blogs and podcasts were recorded. So, in the past year, we've had to deal with a lot of medical issues and a lot of COVID testing, for instance, a lot of mask wearing. Some supplements have shown to be quite effective in helping kids and adults prevent serious illness. And so you might be reading about that or talking to your child's doctor or nutritionist, and you might be wanting your child to take even simple multivitamins, and you have no way to get in that medication. And also the importance of food and nutrition, and that is definitely covered in my book. I have a whole chapter on feeding and picky eating, and that will be really helpful too. So it's a problem across many kids, many areas. So before we get into the 4 steps of how you solve how you begin to solve medical issues and all of these issues that come along with it, I want to tell you a couple stories. First of all, Lucas, when he was about 6 years old, he started, the first thing I noticed was he had open lesions on his legs, like mosquito bites that he had picked open. But it was June. Nobody else had mosquito bites. It was weird that all of a sudden he had kind of multiple open sores on his legs. A few days later, I noticed that Lucas began to have some motor tics. The one day he would go, "Nah, nah," and he would jerk his head to his shoulder and have this little vocal tic. And I didn't know what it was. He was 6 years old. So this is, 15. I can't do the math. It's 18 years ago. So I was kind of perplexed. I was thinking, are these lesions related to these? This looks like tics to me, motor tics. So I began searching on the internet, which thank God was a thing then. It wasn't really a thing back when Lucas was diagnosed. But, I was searching for motor tics, acute onset, because, this came out of the blue. Right away people are like, well, maybe he has Tourette's, which is a tic disorder. But, as a nurse, any behavior, and I was a behavior analyst by this point, any behavior that goes up suddenly, you have to think, I was actually training to become a behavior analyst. You have to think like it's a medical issue. Like all of a sudden, if your 6-year-old starts having hundreds of tics a day, to me, that seems like a medical issue. If all of a sudden Lucas starts banging his head on hard surfaces 50 times a day, you have to think medical. Most behavior analysts and behavior people think behavior right away, and I think medical right away, especially with something that's coming on acutely. So I searched and I found this thing called PANS, P-A-N-S, which stands for, well, I actually found PANDAS first, P-A-N-D-A-S. And it stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep, like strep throat, strep. But strep doesn't have to just be in your throat. Strep could be anywhere on your body, which I didn't know as a nurse. So anyway, my husband is a physician, and we discussed, maybe I'm thinking the lesions on his legs look like maybe a staph infection. No, this is talking about strep. And I knew Lucas had taken a certain antibiotic. So that was kind of the treatment. And so we got Lucas on a 5-day course of antibiotics. And before we did that, we actually got out a clicker counter and we began to click every time he ticked. Now, I have talked in the past about early in my career as a behavior analyst, I would get a clicker counter and I would count problem behaviors like aggression, self-injurious behavior. And now I really keep the clicker not for problems. I keep the clicker for positive things like words heard and that sort of thing. However, it was a long time ago, so I was still using the clicker for problem behaviors, and they were happening really frequently. So if I was trying to tally, it wouldn't be very helpful. So we did click, and we got 500 tics a day. So he was having a lot. We put him on antibiotics for 5 days, just a 5-day antibiotic course. His leg lesions cleared up and his tics went down to 0. So now people might say, I don't believe in PANS or PANDAS. It was kind of a newer thing in the late 1990s. It's not just affecting kids with autism. There's a really good book called Saving Sammy. And another book by the same author, Beth, I'm forgetting her last name, but I'm actually having Beth come on the podcast in the spring later, soon. I'm trying to get her on because she's really a wealth of information. But anyway, we controlled his tics and he went on to need, more treatment for his tics that started at the age of 6. Around maybe when Lucas was 8 or 10, when I had been dealing with PANS and PANDAS, they made the name now PANS, Pediatric Autoimmune Neuropsychiatric Syndrome, because what the latest research shows is that it doesn't have to be strep. It can also be staph, mycoplasma, Lyme. There's many bacteria that can cause tics, acute onset tics, or an exacerbation or acute onset obsessive compulsive disorder. But at the same time that Lucas was having tics, he also began to be aggressive. He bit for the first time since he'd been 2, and his tics were progressing. So the next day before we started the antibiotics, it was like really bad, like really exaggerated motor tics that were getting worse and worse. So we managed to get this settled down. And after a couple of years of experience under my belt with PANS, I was consulting in a classroom, and the staff called me and they said, I know you're coming in tomorrow, but we're having problems with this boy who I'd known, for many years. And he was about 8, I'd say, and he was in a regular public school, but he had been in a ABA, verbal behavior type of classroom for most of the day. And I had known, we'll call him Nick, and they said he's like peeing in the corner of the classroom and he's being really out of control. And I'm like, whoa, this is not, he had higher language than Lucas and he didn't have problem behavior. So what was this all about? And so when I went in to see Nick, to see the classroom the next day, I was already scheduled. What I noticed with Nick was throat clearing a lot, like many times a minute, as well as eye blinking, where he was forcefully blinking his eyes really hard. And I was like, as soon as I saw him, I was thinking, these are tics. He probably has PANDAS or PANS. And so we got data. It was, hundreds of times an hour of both the throat clears and the eye blinks. And Mom was able to take him to the doctor, get him on antibiotics, and resolve his problems as well. So those were some of the early PANDAS problems. Then fast forward, when Lucas was a teenager, he began having more self-injurious behavior, more aggression, and they were almost always related to pain, Lucas being in pain or being startled. And he was big. He was over 200 pounds at that point. And it was a really scary time because I had gone to many physicians trying to get help. I was trying, people were saying, well, you're going to have to put a helmet on, or maybe it's puberty, or, and I was just thinking, or you need antipsychotic drugs. And me as a nurse realized, I just knew that this was so sporadic and so pinpointed to pain or startle, that I didn't want to put him on medication to like zone him out the whole day, And so we finally found Dr. Michael Murray, who's on episode number 28, and he diagnosed Lucas with an I'm blanking on the name. Okay. Dr. Murray diagnosed Lucas with an autonomic nervous system dysfunction. I was like, had my PANS in my mind. And that is pain and startle and having problem behaviors. And there's just a lot of other things that, other symptoms of autonomic nervous system dysfunction. But basically, Lucas's level of excitement, stress, everything was way above where everybody else's was. So it didn't take much for him to get startled or pain to have him go into a fight or flight mode. You may have heard about that, fight or flight mode. So flight means you pass out, you exit the scene, you're just like, you fly away. But fight means you aggress. So if you are in pain or startled, you have a fight mode, like you're being attacked, you would fight back. And so Lucas, the pain was so bad that he would go into fight mode. So with the medication, which ended up being a cardiac medication, that Lucas has been on since the age of 18, his problem behaviors is well controlled. His autonomic nervous dysfunction is well controlled, and he's doing exceptionally well. So those are stories, and I know they kind of went a little long, but I think it's important to know that kids can have medical problems that can cause behavioral issues. It could cause Nick to pee in the corner of the classroom, and his issues all resolved. His eye blinking went away, his throat clearing went away, and his bizarre behavior went away as well. With Lucas, we treated medical problems. Those weren't the only two medical problems along the way, but those were the two biggies that if I wouldn't have been able to figure it out, it would have been even, I can't imagine if we wouldn't have been able to figure those things out. So I do think that a lot of our kids on the spectrum, especially kids that can't really tell us they're in pain, are having pain and having medical issues that we need to be diving a lot deeper in. I also did a podcast episode with Dr. Timothy Bulmer, who's a well-known researcher in the autism arena. And we talked a lot about biting, and when kids bite, he's a believer that it is probably due to pain or stress of some nature. So you may want to listen to that podcast as well. We'll put that in the show notes. So what are you to do if you have a child or a young child showing signs of autism, and an older child with moderate to severe autism who's not fully communicating? I mean, thank goodness Lucas can tell us head hurts, belly hurts, neck hurts, whatever. He can tell us the basics, but he can't say the pain starts here, it goes down to my ear, it's a stabbing pain. He can't tell us any of that. So, but many kids can't tell us any of that. And so we just assume that it's puberty or anxiety or some behavioral issue when it is actually pain or stress. Okay, so let's take the 4-step Turn Autism Around approach just to walk you through what you should do. Even if you don't think it's a medical problem, it might be, and you might come across it to be a medical problem. So assessment is number one, the first step of the Turn Autism Around approach. And we need to really assess whether we are taking a clicker counter and counting the number of tics, whether we are using our calendar, which is described in my book. I also did a video blog on my calendar system where we are recording problem behaviors. We're recording medication changes. We're recording supplements added, blood draws, doctor's visits. If a child is overweight, we're recording the weight. If the child has sleep problems, we might be recording sleep. The calendar is a big part of our assessment. It's also a big part of the 4th step, which is evaluation using data. And a lot of these steps kind of roll together. So assessing not just the child's language and their problem behaviors and their imitation skills and their matching, but we are assessing, did you go to the doctor? Did they check hearing? Did they check allergies? Does he have a diagnosis? Do they have a blood draw to rule out lead levels being too high or nutritional deficiencies? At my podcast with Dr. Keith Williams, episode number 95, is a real eye-opener too, because he's seeing now, just in the past couple of years, he's seeing multiple cases of scurvy and rickets and all kinds of things from major nutritional deficiencies in our kids. That's not something you can treat behaviorally. We have to involve medical professionals. So that assessment is so key. The second step is to make a plan. If you want to teach your child to take medications or tolerate a mask or tolerate a COVID test or tolerate an ear check or a blood draw, we're going to have to make a plan of where we're going to practice that, how we're going to break down the steps, what we're going to do, because just fingers crossed, maybe next time the blood draw will go better is not a plan. And to do it while a child's crying or to hold a child down will have detrimental effects longer term, and it may roll over into problem behaviors in other areas. So making a plan, setting some goals. The Third step, so the first step is assessment, second step is plan, third step is teaching or intervening. We're going to have practice sessions for your child to tolerate pill swallowing, medication. In my medication video blog, I talk about how when we started pill swallowing with Lucas, we used applesauce and dunked a small little pill. And he swallowed it. And now, still today, Lucas takes all of his medications. He dunks them himself in applesauce. So we need to like fade in all of our demands and have strong reinforcements. Too much for me to cover today, but that's the third step, is to teach and to intervene with teaching children how to tolerate medications and procedures. I will say that part of the teaching to get children to tell you they're in pain is to get children to touch and label body parts on command. And in my book, in my online courses, I really stress the importance of potato head and identifying body parts, because if they can't touch a body part, like touch belly, they can't touch belly. Or if they can talk, if they can't label this is a nose versus this is ear versus this is neck, we're going to be much farther away from them being able to label pain. So may want to watch that video blog on how to get your child to tell you they're in pain. And then the fourth step of the Turn Autism Around approach is to use easy data to evaluate whether you're making progress. Like if I wouldn't have gotten that baseline data on Lucas with 500 clicks for his tics, and before we started, for a couple days before we started antibiotics, and written it down somewhere, I would not have known. But I didn't start my calendar system back then. I started my calendar system probably a decade ago, which is still a long time. And this calendar system, where we write down any self-injurious behavior, any headaches, any Motrin, any allergy shots, any doctor's appointments, any antibiotics. Lucas still will have tics sometimes, and we have to write them down. His tics now don't look like his tics did when he was little. He actually has burping tics when he gets a PANS or a sinus infection. He'll get burping tics. So we record those, we count those, and we treat if needed through our physician. So that is what I got for you today in terms of ruling out medical problems, treating medical problems, really helping kids reach their fullest potential by not just narrowly focusing on the behavior or academics, but we really want kids eating better, sleeping better, communicating better, low problem behaviors, and that is all in my brand new book, Turn Autism Around. This is the book I needed when my husband first mentioned the possibility of autism when Lucas was 21 months. This is the book I needed when Lucas got diagnosed with moderate to severe autism at age 3. This is the book I needed when he was 5 and still not potty trained completely, when he was 10 and had never slept through the night in his own bed. This is a book written from my experience as a nurse, as a mom, as an advocate, and as a behavior analyst. So I hope you'll get the book if you haven't ordered already. Download all the book resources at turnautismaround.com. And I hope you enjoyed this episode all about medical issues in the autism world, and I'll catch you next time. All right, I think I can use that for a podcast. We're killing 2 birds, 1 stone. I don't know if that's politically correct to say anymore, but okay. So Gorgeous says, I use a body chart for my daughter who's autistic. She's 8 years old, nonverbal, not completely potty trained. The goal is for her to point to the chart to show where it hurts. It can still be hard. Yeah, so I would really recommend that you search Mary Autism Potato Head, start teaching her to request by touching her body parts. So she requests the nose eventually and gets the nose and puts it in Potato Head. Using a chart or like a whole, if this was a picture of a real boy with a body and everything, you could say like touch his eyes or touch his ears or touch his mouth. But when there's something in it for the child, like getting the nose of Potato Head and putting it in, you'll probably have a lot more success with teaching body parts. And this is all explained in my book and my courses. My son doesn't talk. Yes, and Gorgeous says she does have Mr. Potato Head. Yeah, learn how to use Mr. Potato Head. You can search and find a video blog on that. And of course, it's all in my online courses as well. I don't know how, I do talk about Potato Head in the book too. And just because your child's 8 or 7 or 8 doesn't mean you don't need the book. The book is going to be super helpful if you have any trouble with talking, tantrums, potty, sleep, eating. You name it, it's in there. Advocacy. Crystal says pain is our hardest. My son is 3 and nonverbal. We are on phase 2 PECs and working on moving to the pro low quo. And Crystal, I would say really, if he has, even if he doesn't, but I would really look at my book and my courses, because I've seen many kids get prematurely put on talking systems that really we want to make sure he's not drinking out of bottles, pacifiers, make sure he's eating from spoons and stuff that's going to help his oral motor system progress, and make sure we're working on sounds and word approximations. You can keep the PECs going, definitely, if it's working. We can progress to pro low quo, but my focus is there's very few kids that I think can't talk in the long term. Now, that's not to say they'll be fully conversational, but I think talking isn't worked on enough, vocal language. And I teach you all how to do that in my courses. How can I get the book? TurnAutismAround.com will get you all the information. It's available everywhere, but if you get it, or if you've already ordered it on Amazon, go to TurnAutismAround.com and put in your email address there and stuff, and you'll get all the resources, all the forms from the book. You'll be able to fill those out. So you really are going to want to go to TurnAutismAround.com. You can watch a little video about the book. You can figure out where to order it from. You can order it on Amazon, Walmart, Target, Books A Million. If you're overseas somewhere, you can order through our international order button, or you can search out wherever you are. What did Nick have? Nick had PANDAS too, pediatric autoimmune neuropsychiatric disorder, and he was treated with antibiotics and improved greatly too. I've had a bunch of clients that have had PANS and PANDAS. It's very common. My son is 3 years old. He has a lot of drooling. Well, definitely get the book and, work on, like, if he's on a bottle pacifier, if he's not eating from utensils, that all can lead to drooling if all of that is not happening. The other really good thing about drooling, I have a client, Cody, who's mentioned in the book, and he's on my online courses. Cody had a lot of drooling for 2 years, and we started a program called Talk Tools. I did a podcast interview with Mags Kirk, who's an SLP, speech and language pathologist, and a behavior analyst, and she is an expert. She's certified in Talk Tools. So search Mary Autism Talk Tools, TALK tools. I think it's one word. And listen to that, because if I had a child that was drooling, or a client, I would totally look into that, because we had dealt with drooling for 2 years. We started that and it went away. Zoel said, thank you so much for all this valuable information. I always learn something new. Awesome. Well, we're about a month ahead of time in terms of our podcasts and stuff. And I got a question in our online community with our paid courses, and it was about COVID testing. And I tend to get on my soapbox all the time about, medical issues. So I thought I could probably pull off a podcast, get myself a little ahead of the game. Will not use silverware. Yeah, so in my courses, we talk all about how to shape that up. It's a very important skill because if you're not clearing a spoon, for instance, you're also not potentially putting your lips like that and making the sound. What do you recommend for kids who have medical reflux and food aversions? Are they related? Yeah, I think reflux and food aversions are very much related to, the food aversions are definitely related to autism, and reflux is definitely related to food aversions. So yeah, work with your doctor to get endoscopy, to get medication, to get supplements, to get your child eating foods that aren't causing reflux. All of that. My brother's son does not chew his food. What can we do for that? Yeah, it's just a process of teaching the child to eat smooth things. Then, when I hear that, though, I say, does he chew anything? Because some kids can chew corn chips, but they can't chew meat or chew broccoli. And that is more of a food aversion thing. That's more of a not a can't, but a won't, which is still a serious problem. But it's a process. It's not like, oh, Mary, you gave me one little tip and now he's going to chew and swallow. No, it's a whole process. Chapter, I don't forget what number in my book, but the chapter on feeding will really help. Also, if you're having feeding problems, so what is Talk Tools? Talk Tools is a system that uses straws, whistles to improve your oral motor drool. So it helps with drooling, feeding, and talking. It's called Talk Tools. So instead of going to the Talk Tools website, go search Mary Autism Talk Tools all together. Mags Kirk. K-A-R-K. Listen to that podcast, and she explains what Talk Tools is. Aisha says, really, I feel empowered when I watch you every day. Well, that is awesome. I think we're catching Lily Daisy in her sleep, but she wasn't able to join us live yesterday, so So I have a little bit of time, and I am going on the Hay House Facebook page now. In just 5 more minutes, I'll be getting ready to go on there live at noon. So if you are still wanting to watch more of me, you can hop on over when I get done to Hay House, to the Facebook page on Hay House. You don't have to join a group or anything. Just type in Hay House, 2 words, and catch me over there, because I'm going to go live talking about my book there. So I thought, well, I'm all dressed, all ready, just had my TV interview. Now I have the Hay House. I wanted to get this done. So, what are your thoughts on dental visits? My son has to be strapped in, but I do not see it as a long-term solution. He's 8. Yeah, it's not a long-term solution. I have a whole chapter in my book on doctors, dentists, and haircuts, where we always also talk about how we had to desensitize a bathtub to some little girl who got held down for an MRI, and it spilled over to her resisting baths. It's not a good long-term solution. I talk about this if you search Mary Autism Dentist, I show you how to practice dental visits in your own home. And you can buy at the dollar store or online. You can get a little dental mirror and little pick. and you can start practicing dental visits. So strapping kids down, holding them down, letting them cry, cutting fingernails in your sleep, trying to give injections when a child's sleeping, trying to put on creams when a child's sleeping. None of these are good long-term solutions, because soon you're going to have older child who's 100 or 200 pounds and going to be a problem. So we want to get to pairing up and doing things in a safe and humane and child-friendly way from now on. So if it's your child's 8 or 18, you can learn the steps to turn things around and make your life better. That doesn't mean it's a cure. It means you are turning things around to help your child or clients be as safe as possible, as independent as possible, and as happy as possible. That's it. Reaching your fullest potential isn't like a one-time stop. That's constantly, the bar has to be kept high, and you have to constantly be thinking smartly, using the 4 steps: assessment, planning, teaching, and keeping easy data to make sure you are not just chasing your tails, that your life is getting better, your child's life is getting better, and you're moving forward. That's all what it's about. So turnautismaround.com. Get the book today. Get all your free resources at turnautismaround.com by giving us your email address. And we are going to get this into the hands of the millions of people who need it. So thank you for tuning in today. I'll be back tomorrow for day 26 of our 30-day live streak. Have a good one. Bye.